Attacks on mental health staff have risen to more than 30,000. That's an increase of about a third over the past 4 years. But a mental health trust in East London has bucked the trend and achieved what they say is a world first by reducing violence by almost 90% in some wards. The trust has gone from being one of the most violent in England to the safest. Caroline Turriff reports.
Rapid response team to Ivory Ward, very urgent. Emergency on Ivory Ward.
This is what happens when there's a violent incident at Newham Mental Health Centre. Events like this used to be very common at East London Foundation Trust. It covers relatively deprived boroughs with high levels of addiction and mental health problems like Newham, Tower Hamlets and Hackney.
Patient was brought in via the police. He decided that he wants to abscond, he wants to run away. So he gave me a big punch on the face and I dropped dead on the floor. So at the same time, I stand up, I pull my alarm, all the team came in and we were rushing towards him. He turned back and gave me another punch. I was off for 3 months.
Unions representing healthcare workers blame a fall in the number of mental health nurses for the rise in attacks. And the significant fall in the number of inpatient beds mean people have to be more unwell to get a bed.
There inevitably is going to be times when you see violence and aggression in a place like this. There can be a state of mind where they're confused or frightened, and they would respond to that sort of experience by fighting back against people who are trying to put them in a place they don't want to be.
This patient, William, says violence is often triggered by minor incidents.
Most of the trouble starts when two things. They don't get their places to go and smoke, or the patients accuse another patient of stealing something from his room. A guy said that another guy went in his room and took his socks. He ended up in a fight. The ward feels a bit safer and calm because they've got more staff now.
I've been around all the wards and it feels pretty safe. East London Foundation Trust has managed to reduce violence in some inpatient wards by 88% and across all their wards by almost 50%. And this has been maintained for 2 years. This is particularly striking as rates of detention under the Mental Health Act are far higher in London and other cities as more people suffer from mental health and addiction problems.
Topaz Ward, do you feel safe today?
The staff at East London Foundation Trust have achieved the reduction in violence without spending a penny extra or using any extra medication.
Staff are, do you feel safe today?
Yes, we are safe.
The daily staff meeting in which they discuss the risk of violence from individual patients has been key to the programme's success, as has the safety cross.
A green dot means there's been an incident-free period. An amber dot means there's been perhaps a verbal incident, and the red dot here means that there's been an incident of physical aggression.
Staff also give patients a full programme of activities, including table tennis. In 2013, when the Violence Reduction Initiative started, this trust was one of the most dangerous in England. Now it's one of the safest. The project is being rolled out across all the Trust's hospitals in Bedfordshire, and its managers are in talks with other London trusts who want to emulate the success of the programme. Caroline Turriff, BBC London News.